oral surgery or, extractions, taking teeth out we do it routinely every day here. It's not always the number one option. I mean, we obviously would like to restore the tooth if that's possible, but a number of different reasons come into play as to why we can't. Maybe the tooth's just too far gone to restore it. It's got to come out. Maybe finances play a role in, doing the work that needs to be done is just not something that is in that patient's possibilities, and so taking the tooth out is the only thing that we can do. And most of the time, patients are in pain, and so we've got to either figure out we're either going to do a root canal or whatever to get you out of pain, or we're going to have to take this tooth out. We kind of talk through the process, The anesthesia for most anything in the dental world is pretty routine, but just trying to let the patient know that, this is what to expect. We're going to numb you up. There's going to be some pushing. There's going to be a little bit of pulling. You're going to feel some pressure. And then the tooth's going to come out, and you're going to be okay. If you want to replace that tooth down the road, we got plenty of options. But at the end of the day, it's just talking patients through what to expect, let them know up front what we're going to do. The rest of it's fairly routine. That's easy for me to say on this side of the chair, right? I'm over here, you're over there, so tell me from your perspective, what are you feeling right now? How can I help? What questions do you have? That's what I'm here for, ask me, I'm happy to answer whatever I can. So just always trying to it's real easy when you're doing this kind of thing to assume, because you do it so often, that the patient knows what you're fixing to do because it's routine for us. And so just trying to remember that, okay, they may have not walked through this before. What can I answer for them? How do I make them feel more comfortable?